tell you what, Dr. Dorian's a hard act to follow, so this is going to be difficult. Thank you, Amy, and thanks to the Knoxville Business Journal, First Tennessee, LBMC, and Virginia College for bestowing these awards and supporting the initiative of Healthcare Heroes. I want to voice my appreciation and surprise in joining Bob Koppel, Bernie Bernstein, and Pete DeBusk in receiving the Lifetime Achievement Award. Knowing all three gentlemen and the contributions that they have made to healthcare in our community, I consider it an extraordinary honor to be included in such a group. I also want to thank the hospital executives who served in the awards evaluation committee. This award is more meaningful to me because I know these individuals and their capabilities and commitment to excellence. The first acknowledgement I must make in accepting this award is my thankfulness to God in affording me extraordinary opportunities and blessings and directing my life in a far better plan than I could have ever designed. I also must credit my parents and family members. My parents are both deceased. My father worked at Alcoa, and my mother was a registered nurse. My two older brothers, Jim and Steve, were tremendous examples for me to follow. They were the groundbreakers in our family as they were the first to attend college, one graduating from from UT College of Pharmacy and the other from UT College of Medicine. My younger brother, Dennis, who is also deceased, was a role model for me in helping others as he was a skilled teacher and touched the lives of many kids. I also want to thank my wife, Karen, and my stepdaughter, Kristen, for their support. Let me emphasize today, I accept this award on behalf of all my colleagues at PYA and affiliated organizations. I want to single out some long-term members who have been with me along the way. First, Doug Yoakley, my co-founding partner, as well as Marty Brown, Doug Arnold, and Butch Billick, all of whom have been my partners and friends for over 20 years and have served on the PYA Executive Committee. Not once have they ever questioned the devotion of hours and resources by PYA to community initiatives. Instead, they voice that we are extraordinarily blessed and must act responsibly because of these blessings and giving back to our many communities. I also want to acknowledge Rhonda Clark, who's been with me for 28 years as my assistant, and Barry Silver, our Chief Operations Officer, who each and every day is an example of a Christian leader who always puts others before himself. We have an extraordinary culture at PYA, and all my partners and colleagues deserve that credit. I'd also like to say I had a grand plan for getting involved in healthcare, but nothing could be further from the truth. I was a lost ball in high weeds, to be frank about it. Fortunately, while I was at Ernst & Ernst, today Ernst & Young, and wondering what career path to follow, Ray Groves, then chairman of Ernst & Ernst, realized that increased federal funding and an aging population would lead to significant growth in the healthcare industry. He wanted Ernst to be a leader. He established a healthcare program to educate a small group of 18 young professionals on healthcare matters to become healthcare consultants. I'm thankful that Walter Borff nominated me to participate in the program that provided an education I could not have purchased for any amount of money at any university. An extraordinary journey then began after my first assignment in Hartford, Connecticut. I got to return to Knoxville, where I was blessed to work with Fred Spencer at East Tennessee Baptist Hospital, its then CFO. Instead of complaining about an inexperienced consultant, which is what I was, he took me under his wing and ensured that I looked like a star. To this day, we utilize many of the management practices that Fred Spencer imparted to me in 1977. I was hoping to have Fred here as a guest today, but unfortunately, Fred passed away just last month after extended illness. So please remember Fred and his wife Nancy in your thoughts and prayers, as I know Fred was a mentor to at least a half a dozen people in this room. In late 1977, I was also fortunate to meet Bob Koppel, a young new administrator at East Tennessee Children's Hospital. Not only have we aged together, he was a tremendous example of an effective CEO and leader, always prepared and pursuing a strategic vision. I am grateful that Bob recommended me as a founding board member and treasurer of Ronald McDonald House here in Knoxville. I've been blessed by literally every organization in this town. In 1978, I had the opportunity to work with the Sisters of Mercy and its then CEO, Sister Marie Moore. She exposed me to ideas I will never forget regarding clinical care, including the coming growth in outpatient services. She was truly a visionary about that. I also had the opportunity to work with the Adventist Health System in several underserved areas, including Jellicoe, Tennessee, where the community hospital had failed and had stepped in to reopen it. The Adventist model of servant care has made a lifelong impression. Many physicians have served as role models, combining extraordinary skills, caring personalities, and an unfailing commitment to helping others. They include Dr. Jack Lacey and Dr. Mitch Better, both of whom I consider great friends, and I'm delighted they're both here today. While PYA was still a small firm of less than 10 people, Mr. E.B. Copeland, the first president of Fort Sanders Alliance, then parent company of what today is Covenant Health, allowed PYA to serve as advisors to him and the organization. His extraordinary faith in the young firm enabled us to showcase our capabilities. It also allowed me to witness the impact of a strong leader can have on an entire organization and community. His leadership was instrumental in reversing the course of a declining organization onto a path of extraordinary success. EB's 92 years old and still plays golf 2 to 3 times a week. That would be extraordinary. EB is here today, along with his daughter, and I want to say a very public thank you to Mr. E.B. Copeland. I'd like to now share with you 2 examples as to why healthcare organizations are so important to a community's well-being and future growth. On July the 14th, 1966, I was a young kid looking forward to having dinner with that evening with my family to celebrate my 14th birthday. Unfortunately, just before noon, my mother was in a horrific head-on car crash. My mother fought to retain consciousness as she was certain her neck was broken. Upon arriving at Blount Memorial Hospital, they immediately began treating her critical injuries. But technology being what it was then, they could not detect any fractures in her neck. Fortunately, Dr. Jim Proffitt, a legendary physician in Blount County, was called. He stressed first and foremost they should listen to the patient and treat her as if her neck was broken. In approximately 1 week, after repeated x-rays, they found 3 fractures in her neck. Dr. Proffitt was amazed that she had not died and was not paralyzed. Instead, my mother went on to live for 30 years in extraordinary health. I am certain had my mother not received such exceptional care at Blount Memorial, I would not be standing before you today, and PYA would have never been formed. Approximately 13 years later, my younger brother, Dennis, was diagnosed with a large brain tumor. The prognosis was dire. Should he live, he would certainly face a lifetime of physical and mental impairments. Fortunately, through Dr. Lacey, we learned of Dr. Bill Reed. Dr. Reed performed 2 surgeries over the course of 18 months, and my brother went on to serve as a school teacher for 24 years at Alcoa High School, helping to establish the Alcoa High School Alternative School. And he literally touched thousands of lives over that period of time. Now I will choose to close on a very personal note. Hopefully I can get through this one. 3 weeks ago tomorrow, I spent the morning with Dr. Lacey working on ideas for the Governor's Task Force on Health and Wellness in Tennessee. I mentioned to him that I was experiencing headaches. He offered to examine me, but I brushed him off and said I would come to see him if I didn't feel better. Over that weekend, I could tell my condition was deteriorating, so I called Jack on Monday and an MRI was scheduled. The MRI images showed a large subdural hematoma resulting from a couple of blows I'd received in sporting accidents a few weeks prior. The next morning, as I was looking up at the lights while being wheeled into an operating room, I realized my entire life and future rested in the hands of caregivers. It definitely added a personal element to my perspective on the role of healthcare. So I stand here today before you with my 4th grade haircut, which we used to call a burr, and I understand now it's a buzz. Just another one of the many hundreds of thousands of people who, over time, have benefited from the extraordinary care in this community. Because of that extraordinary care, today I can say to my 230 colleagues at PYA and affiliated companies, I will soon get to rejoin the greatest group of people anywhere. The Gospel of Luke tells us that to whom much is given, much is required. While I feel honored to be recognized by this award, I believe I'm running a large deficit in my balance of payments account right now. The blessings I've received from this healthcare community far exceed any contributions I've made. May God continue to bless our country, our community, and all the healthcare providers and organizations who answer the call each and every day to deliver extraordinary care. Again, thank you for this honor.